Coming up today, information matters. This morning, how one simple decision prompted by this program led to a life-changing diagnosis. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Today, we are sharing the story of Kristen Hatfield, a mom of 5 who credits watching this program with prompting her to take action on her own health, a decision that led to a breast cancer diagnosis she never expected and a treatment that made all the difference. Here's Alexis Del Cid.
Smack in the middle of nursing school while raising 5 kids, Kristen Hatfield already had a full life and a full house.
3 boys and 2 girls, so 16, 13, 12, and twins that are 8.
And like so many busy moms in the thick of it, her own health just wasn't something Kristen had time to pay much attention to.
It was totally not on my radar at all.
Until one day while scrolling the University of Kansas Health System's YouTube channel.
The title was like, more younger women are getting breast cancer and they don't know why. In the video that I watched, the young lady, she was like 33, I think. I might have died.
Kristen realized with a start that at age 41, she had skipped her yearly mammogram recommended at age 40. She did a self-exam.
I did one and I was like, oh, well, there's something unusual there. I felt a lump that I didn't feel anywhere else. It was strange.
Then she made an appointment to get that mammogram at the University of Kansas Health System, and it's a good thing she did.
The radiologist came and talked to me and said that he was 99% sure it was DCIS, which is ductal carcinoma.
Ductal carcinoma, cancer within the milk ducts, and she had numerous tumors in one of her breasts.
They were actually pretty large, and there were several of them.
That's when Kristen met her University of Kansas Cancer Center team that would lead her through treatment and recovery.
My care was amazing. They were so patient and kind.
Among them, her breast surgical oncologist, Dr. Larson, who gave her comfort in a way she never anticipated.
We actually got to pray before surgery. We just said the Lord's Prayer, you know, and that was so nice and comforting.
Because there were so many tumors, a lumpectomy was not an option. Dr. Larson removed Kristen's entire right breast. The surgery also included a biopsy of her lymph nodes, which revealed good news. The cancer had not spread. Today, Kristen is considered cancer-free. And while she knows she can't change the past, she does have her if only and what if moments.
If I had gotten a mammogram when I was 40, maybe I would have just had to have a lumpectomy and not my entire breast.
But she's choosing to move forward and not dwell, instead using her experience to educate other women on the importance of yearly mammograms and self-breast exams, and paying attention to your own health no matter how busy life gets.
And Kristen Hatfield joins us via Teams this morning, along with Dr. Larson, her breast surgical oncologist at the University of Kansas Cancer Center. Great to have both of you with us this morning. Joining us here in studio with us is Dr. Ido Hu, Kristen's medical oncologist. Dr. Hu, good to have you with us.
Thank you for having me.
Thank you for joining us. Kristen, I want to start with you. You said that you saw an episode of our program, the Morning Medical Update, online about younger women being diagnosed with breast cancer, and just something clicked with you. What was it?
I thought that the title was really intriguing. I wondered why. I'm like, why is that happening? And it wasn't something I was even thinking about, but I just clicked on it, and I mean, it was the best decision I probably have ever made.
No doubt. You almost, though, talked yourself out of getting that mammogram. What would you say to women having that same internal debate?
I would say just do it. Don't think about it too much. Just follow the guidelines of getting those screenings on time, doing your self-exams, and, you know, you're worth it to a lot of people. So.
Absolutely. Absolutely. Yeah. When you're having that little tap on the shoulder moment, listen to that inner voice. Dr. Hu,
yeah.
Kristen was diagnosed with DCIS, or what's called ductal carcinoma. What can you tell us about this type of breast cancer? Because there is several types.
Yes, so in situ, well, its Latin means in the place. So just as the name implies, DCIS, ductal carcinoma in situ, is the cancer that's enclosed by the milk duct system of the breast. Sometimes we also call it stage 0, but it doesn't really imply that it's not cancer. It is still cancer, just like you mentioned. It's one type of the breast cancer which can comprise about 20% of all new breast cancer diagnoses.
So Kristen didn't need chemotherapy or radiation. So how do you determine when those treatments are not necessary?
Yeah, so the most important treatment, as I'm sure Dr. Larson is going to tell us, is the surgery. So Kristen had a mastectomy, which removed all the breast tissue. So in that case, usually radiation is not needed. And chemotherapy is the need, the importance for chemotherapy is to treat any loose cancer cells that are already spread out. And for that, DCIS have very low risk of loose cancer cells, so we usually don't need to use chemotherapy. The risk of chemotherapy outweighs the benefit in this case.
We heard it had not spread,
no,
which was good news. Dr. Larson, the good news was that Kristen's cancer was found early, but she still needed that mastectomy. Can you explain why that was?
Yeah. So Dr. Hu alluded to this a little bit. We have to mentally separate out a bit in our minds the biology or the behavior of cancer. That's a lot where the medical recommendations come in, the chemotherapy, the hormone blockers, those type of things, versus the anatomy of the cancer, which is where the surgeons come in. So sometimes we might have something that's biologically not aggressive, like DCIS, but that is spread over a larger anatomic area. So the surgery that's recommended really is trying to address the anatomy of the cancer, the physical presence, the physical distribution. So sometimes in cases like Kristen's case, as she shared, there could be multiple areas of cancer, a larger distribution that just requires a bigger operation to address.
So what's the conversation like when talking to a patient about different surgical options? And are there certain cancers where more aggressive surgeries are recommended?
Great question. So surgery is, again, all based on anatomy. So if I have a biologically aggressive cancer, meaning a type of cancer that wants to spread elsewhere in the body, I can't do a surgery that actually combats that or gets around that. So that's where we have to then rely. Dr. Hu was so kind to see that surgery was the mainstay for DCIS, which is really important. But sometimes the medical oncology piece is the most important. So we want to be mindful to tailor the cancer treatment to each individual patient. That's tailoring the anatomy, the surgical operation, tailoring the biologic treatment, the medical treatment. We've known for a long time that lumpectomy and mastectomy in general have equal cancer outcomes, but we just have to be mindful that ultimately it depends on the anatomic distribution, what surgery is right for a particular patient.
Kristen, you said that your entire care team was great. What specifically stands out?
They were very patient with all of my questions. I had a lot of questions and I was intense at times because, this was a big deal to me. And they were so patient, and the messages that I sent on the portal, they responded to so quickly. They were just all very kind and understanding and very patient.
You asked Dr. Larson to pray with you. Tell me about that experience.
Yeah, so that morning before surgery, we were talking, and she mentioned she had just gotten back from a missions trip in Africa, and we were talking about that. And before we were going back, I just felt like I would really like her to pray with me and my husband. And so we just said the Lord's Prayer, and it just was so nice to do that before, surgery is scary, and even if it's something simple, but it just brought so much peace for me. So,
Dr. Larson, I heard that you always ask patients if they would like you to pray with them. Why is that so important to you personally?
Important to my life. So I am Catholic by background, and have many patients who are Catholic or Christian or other faith denominations. And we we know through our own individual lived experience how important that is to ourselves, to our lives, to our mental health, our physical health. But we also have really good medical data that says that having that foundational support of faith, family, friends, we have improved cancer outcomes. So we see improvement in patient-reported quality of life, less depression and anxiety, improvement in getting back to functioning. So I think just both the personal side of care, acknowledging that this is a person in front of you who's going through something important, as Kristen shared, and how can we support them in that, and try to make that connection and that relationship with people. So within my chart, within O2, which is our electronic medical record system, there's a spot where patients can self-identify religious affiliations. So if faith is something that is important to a person, please consider filling that in online or asking your doctor to help fill that in. We want to know if that's something that's important to you. We want to be able to talk to you about that as something relating to your care and to offer those type of things to help people along their journey and in their story.
Dr. Larson, I don't know if everyone knows that that is there on my chart. So thank you for pointing that out. That's a really important thing to know. So thank you. And thank you both for sharing that part of your patient-physician story. Dr. Hu, Kristen's cancer, as we've mentioned, was caught early, which we love hearing, but she still, of course, needs long-term follow-up. Why does cancer-free not always mean care-free?
That's a really great way to put it. So I usually always tell my patient up front, even you have the best surgery, you have mastectomy, even I'm not going to give you any medication, you're going to be working with us for a very long time. As we all live longer, even there's always a chance that there's maybe additional cancers may develop. So it's very important to have a long-term follow-up.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Kristen, I have to ask you, you have 5 kids. They vary in ages, so I would imagine you had to have different conversations with them, or was it all one big conversation as a family when it came to your cancer diagnosis?
We kind of, we didn't want to make a huge deal out of it, because we knew that it was caught so early. It was really best case scenario. If you're going to have cancer, like that's the kind to have for breast cancer. So we didn't want to interfere with their lives too much. So, we did tell them that I had it and that what to expect and what we could kind of hope and pray for. We were hoping and praying that my lymph nodes were going to be clear, and so they understood that. But we just tried to make it as chill as possible to not upset them too much.
Right, I would imagine not wanting to scare them, but maybe for other parents with young kids, do you have any advice, or did your kids have any questions for you that maybe you could help other parents navigate this kind of unknown time that they might be going through?
I think that it's best to just be honest and keep it simple, and just ask the questions, or to answer the questions that they have, and not really expound on it too much. I would just say keep it simple and just be honest.
Great advice. Kristen, as we mentioned, you were in the middle of nursing school. How did that medical knowledge help, or maybe did it hurt, maybe knowing too much as a patient during this time?
I think it helped. I don't have a ton of knowledge and I'm still in nursing school, but I think that it helped me to compartmentalize and think of it more objectively as like a medical condition. And, this is how it's, what we do to treat it. And so I think it helped actually. So.
Dr. Hu, when we hear stage 0, and I have to admit, stage 0 sounds maybe as big of a deal, or it might sound minor. Why is DCIS still something you have to take very, very seriously?
Yes. So stage 0, I think they may not be a very good word to put it, right? Because you think 0 means less important. But it's very important to realize that DCIS is still a cancer, and if left there without appropriate treatment, it may develop invasive cancer at a more advanced stage. And as it turns out, when we do the surgery, up to 20% of the DCIS as initial diagnosis actually being upstaged to invasive cancer. So it's really important, even though it's DCIS, even the cost stage 0, it's very important to go ahead, get appropriate treatment.
Let's talk about screenings, and let's talk to women who might delay screenings. What does the data actually show about outcomes?
Yeah, so as we know, some cancer maybe grows slowly, takes a long time to be visible, detectable, but as with any cancer, if we live there longer enough, they're going to continue to advance and become invasive, or even worse, become metastatic. So it's really important that we take care of as early as possible. And the most important thing for DCIS is early detection and treatment.
Well, we can't remind you enough. So if you are age 40 or older, remember to schedule your annual mammogram. You can do that with us. You can go online to kucancercenter.org/mammogram, or you can text MAMMO to 913-588-1227. Dr. Larson, what should women know about breast changes that are not maybe painful, but still need to get checked out?
Yeah, absolutely. So our breast tissue has a normal cell cycle. So just like our skin, our hair, our nails, there's a cycle that our breast tissue goes through. And for most women who are premenopausal, it flows a little bit with their hormonal cycles. So it's natural to have, small things that might come and go, especially with your cycle. But if you notice something that's definitively different, like how Kristen shared, and you don't notice this anywhere else, and especially if it persists for a couple days or maybe a week or two, and you're noticing this persistent change, that's a sign that you want to get in with your primary care doctor, your GYN, for a physical exam, as well as to get some imaging ordered to try to see what's going on. So there are completely benign, normal changes. There are changes that are not painful that can be signs of cancer. So it's really just that awareness of what is different for you and noticing that, and then making sure you get those routine physical exams and routine mammograms once you're 40.
Kristen, any family history of breast or any other kind of cancer?
No, I had a great aunt who died of breast cancer in her 30s, but in my mind, I thought that that was like way too far removed. I didn't think that that was applicable at all with family history until they actually went back 3 generations. So, I mean, I guess I did, but I wasn't really paying attention to that at all.
Dr. Larson, what can you tell us about that far removed? Because having an aunt that died, that does sound far removed, but that is quite young, in their 30s. What can you tell us about that?
Yeah. So it would be important for people to mention to your physicians if you have multiple relatives with breast cancer, that could be siblings, parents, grandparents, aunts, uncles, cousins, but also important to mention if you have family members with breast cancer in their 20s, 30s. Important to mention if you have ovarian cancer in any family member, pancreatic cancer. Those are sort of the flags that we want to be mindful or we want to look out for. So if you have any of those things, that's a good idea just to mention again to your primary care physician so that they can help evaluate and see if that family history is something where you might benefit from seeing one of the breast cancer prevention team or seeing one of the breast cancer geneticists, or if it's something that might not be relevant. So just think about those flags. It's always okay to mention it and to bring it up.
So you mentioned that. Are there additional screenings that should be done if there is a family history like you mentioned?
Great question. So some people might qualify for genetic testing. It depends on a lot of details of the family history. So Kristen mentioned, 3 levels of relatives that they go through when a genetic counselor does that testing and that evaluation. Our breast cancer prevention team also can see people and can calculate a person's individualized risk of breast cancer based on family history, even if they don't need or wouldn't qualify for genetic testing. And so there's a lot that can be obtained just through knowledge and through asking. To, again, better understand your personal risk, your individualized risk.
Okay, Dr. Larson, what about hormones? If a woman is starting hormones, should they talk to their specialist about the increased risk? And what are those risks?
Sure. So anyone who does prolonged hormone replacement, that has been associated with an increased risk of breast cancer. It's not a certain number that we can give because, again, everything is very individualized. So whoever is your prescribing physician, you'll want to make sure and ask them about that risk for the particular medical regimen that they're prescribing for you. And then if you, again, have that family history or any sort of personal history of breast problems, make sure your prescribing doctor knows that so they can adjust and tailor appropriately. And again, any questions, you can always get in and see our breast cancer prevention team who can calculate and go over an individualized risk for you based on your own personal history, your own medications, your family, own personal history, biopsies, all sorts of things.
Dr. Hu, how do lifestyle, hormones, environmental factors fit into breast cancer risk, especially when genetics simply don't explain it?
Yes, so breast cancer is a very personal thing, and there's many different factors contributing to it, just like you mentioned. Healthy lifestyle, other treatment, other medications, and many other environmental factors contribute to the overall risk of breast cancer. In addition to the genetics, we are still learning a lot about genetics. When you have a genetic testing that does not explain, doesn't mean there's no genetic factors. As the science continues to progress, we'll learn more and more about the underlying cause of the breast cancer development.
What advances in breast cancer detection give you the most hope right now?
Well, I think always the most important thing is the early detection, be awareness, and support the access for women to get early breast cancer screening. Then I think there's a development of more advanced precision imaging tools that hopefully will be more comfortable and less high confidence as we incorporate new technology, including artificial intelligence, into those technology.
Dr. Larson, I'd like to ask you the same question. What kind of excites you coming down the pike when it comes to advancements in breast cancer detection?
We have just incredible opportunities based on the technology right now to do beautiful work in terms of breast cancer screening. Our breast radiologists are amazing. They can see things that are 2-3 millimeters in size and biopsy it, but they can't see it if you don't get your mammogram and your appropriate screening. So really that's the best thing that we can say is to get in and to do that. And from a medical standpoint, the type of medications that we have now make breast cancer something that is absolutely curable. Absolutely something where people can get back to their happy, healthy lives, their families, their functioning. And so we want to partner with you in that. But the sooner that we can find something going on, the easier and really the better outcomes that we can offer and we can help patients achieve.
And Kristen, if another woman is watching this program the way that you were watching that program that one day and thinking that this just can't happen to me, what would you want her to know?
I would say that I thought the exact same thing, that could not happen to me, that cancer happens to other people, but it can happen to you because it happened to me, and that we need to be vigilant on staying up on our health and our screenings and taking those things seriously.
Well, we're so glad that you found our program, and we're so glad that you then found the Cancer Center. So glad that you're here with us. And then the full circle moment that you're here today with us. So Kristen, as we mentioned, you were in nursing school. When do you graduate, and what are you hoping to do next?
I will be done with my BSN in December, and I'm really hoping to work for KU because they're the best, and my experience with them has been amazing, and they're the best, probably in the Midwest, I would say, if not in the country. So I'm really hoping to get to partner with them.
Well, that would be like the double full circle moment. So that would be fantastic. So we'll be looking forward to that. Well, let's get to some questions from our viewers this morning. And Tina is asking Dr. Hu, what do we attribute to the trend of younger women getting breast cancer? Do we know?
Yeah, so this is a very important question that's been hotly debated in the field. I think in general, the percentage of breast cancer in young women is still low, but in the past few years, we have been seeing increased trend of more and more young women being diagnosed with breast cancer, which in part may be contributing to better awareness, improved early detection, but there's many other factors may contribute to the increased trend. This time, I think there's a lot of study being ongoing trying to figure out this. But one thing we know that we notice in practice is many young women, when they get diagnosed with breast cancer, we find they are more likely to be in a more advanced stage, and the biology seems also be more aggressive, so with high risk of developing invasive or even metastatic disease. So the bottom line is, don't wait. If you have any concern, reach out to your doctor, and when the time comes up for screening, then wait.
Dr. Larson, Sarah wants to know, should women be doing self-breast exams, and how effective are they?
Yeah. So in general, self-breast exams are not the primary component of screening. And the reason is because, as I mentioned, number one, we have natural fluctuations within our breast tissue that can make self-exams challenging. And number two is the imaging can detect things much earlier than what we can always feel things. Having said that, there are many women who have, background like how Kristen's background, where they do notice changes on self-exam. So what we advise in general is awareness of your own breast tissue, your own breast health. And what that means is just noticing if something is really different and if that big difference persists. So should you obsessively check, or do you need to obsessively check every single day? No, absolutely not. Do you need to be a little bit mindful on a monthly or every other month basis? Yep, that's just, good common sense, I would say, in general for all areas of health.
Dr. Larson, last question. Linda is asking, what are some of the early warning signs of breast cancer that women often miss?
Yeah, great question. So the majority of our patients actually are diagnosed on screening imaging, and often, actually the majority, don't have any symptoms. Common early symptoms may be a feeling of a mass, which people describe as a frozen pea or frozen lima bean under the skin, kind of that real hard, real firm texture. Sometimes it can be things like skin changes, nipple areola changes, nipple discharge that might be bloody from one side. Those are little flags that you should go ahead and talk to your doctor, get someone to see you and do an exam and figure out what's going on. But really, we cannot encourage screening enough, because the vast majority of women, if they do screening, they're actually asymptomatic, and that's really what helps us catch it early and have the best outcomes.
Okay, and I'm going to sneak one last question in for you. Can men get breast cancer too?
Great question. So men can get breast cancer too, so it is certainly not as common in men as it is in women. For men, we do not routinely do mammographic or image screening. That can change based on a gentleman's personal history, family history, and some genes. So again, just being mindful of those same things. Men can carry breast cancer genes too. Men can get breast cancer without a gene. So men more often are likely to notice changes on their exam, meaning a mass or one side of their chest is getting larger or growing different, as well as skin changes, nipple changes, and nipple discharge. So men too need to be just generally aware of those things, although again, routine screening is not as common for our male patients.
Great information, Dr. Larson. What's the big takeaway today?
Yeah. I would say, we speak about screening a lot, and that's certainly part of Kristen's story. What I see from her, particularly as an individual patient and in knowing her a bit in this time, is how she is so strong through this, relying on her family and her faith. And as I mentioned before, we know that those are really, really, really important to people's medical diagnoses, just as important as the actual, medical nuts and bolts side of things. So please make sure that you are thanking the friends and family in your life who are supporting you and who are there for you at all times. Please make sure and consider this an open invite to include faith conversations with your physician. Any of us at KU are happy to have those conversations and support that as an important aspect to your care.
Dr. Who?
Yes, so I want to say is breast cancer is a common but highly preventable and treatable disease. So it's really important to be self-aware. And one thing I also want to say all the women out there, and think traditionally you've been kind of putting away your own health behind especially for young women, jobs, families. But I think it's really important that you need to take your own health into account because that is exactly for those responsibility that you need to take care of yourself.
And that's what Kristen did, and we're so glad she did that. Kristen, what's the big takeaway from your story?
Well, I just want to say thank you to you guys for doing what you do, putting out these videos that have so much really good information. And I mean, I wouldn't be sitting here probably today if I hadn't found you guys, to even start this journey. I would probably still be sitting at home with breast cancer. So I really owe it to you guys and my family for preventing me from going down a tough road. And I'm very thankful. And my big thing to say to women out there is just do it. Just make those appointments and follow through with them. Don't cancel last minute. And that's it. Yeah.
Kristen, thank you so much for letting us share your story today and being with us. Thanks to our doctors for their expertise as always, and thank you to our viewers. Coming up tomorrow on All Things Brain Health, multiple sclerosis. It can be a debilitating diagnosis. How one man went from dancing on stage to losing his vision and mobility in a matter of months. We share his powerful story of loss to resilience.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.